Kia ora, my name is Emma. I'm a doctor at Middlemore Hospital, and it's an honour to be here today to speak with mental health nurse Sarah Patton. I have a family full of mental health nurses, so I'm really looking forward to hearing about your journey and the insights that you have to share with people who might be interested in a career in mental health.
Kia ora, it's really nice to meet with you, Emma, and I'm delighted to hear that you've got a family of mental health nurses. My name's Sarah Patton. I live in Wellington, and I've been working in mental health since the 90s, and I now work as a community mental health nurse.
Why did you want to go into mental health and addiction nursing in the first place?
The seed was first planted when I was doing my training, and I had a placement, and my colleagues would often encourage me to take on patients that were coming into the hospital that had mental health needs. And they just used to say, "Sarah, you're really good at this." I found building a relationship and having like a intimate connection with someone way more satisfying, I think, than the general side of nursing. So I just thought, this is for me.
Is there anything that people might be surprised to learn in terms of the work that you do or where you work?
We work so closely as a team because that's partly why I absolutely love it. We have a meeting in the morning where we talk as a team. After our morning waiata, we bring up all the people that we have that we're concerned about or that are in hospital or, that we need to have like a team discussion about. And so, yeah, it's all kind of team-led, I guess.
What sort of impact can it have on people's lives, the sort of work that you do?
Some of the journeys that I've walked alongside would be when someone has come from a place of absolute adversity, living in an environment that's unsafe, and then we're able over time to work towards them having a new home where they feel in control of their life. When they get to the point where they're able to engage in education and work, I mean, that's so rewarding.
Why do you think it's important that the mental health and addiction workforce includes workers from the communities that they help?
People working with their own people is incredibly empowering, and that is the way that people find they can connect. If you come into a service and your people and your culture is represented, then of course you're going to have a better outcome.
What are some of the emotional rewards for you in your work?
I can have days at work where I feel hugely moved by some of the progress that people have made and some of the difficulties that people have overcome, and I feel enormously proud and touched. I love it. I do absolutely love it. The job satisfaction is amazing, and it's super hard work, but it's a job where I really feel like we make a difference.
Yeah, it's incredibly important work. I couldn't do it. Hopefully our paths will cross again at some point.
Yeah, that'll be super awesome.
Yeah.
Okay, take care.